Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new self-help homeopathy program. I invite you to visit us at selfhelphomeopathy.com. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at selfhelphomeopathy.com.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition. So, in terms of homeopathy, homeopathy has been found to be quite effective in the treatment of vaginitis. Typically, the dosage that you will use will be on the order of 30C or 30X, and typically I will give this potency maybe 2 or 3 times a day, 2 to 3 pellets. Usually you will see a response to the remedy if you've chosen the right remedy in 24 hours. And if you don't see any response, I will typically move on to another remedy at that point. More severe yeast infections, or ones that don't seem to be responding to homeopathic treatment, should be referred to a qualified homeopathic practitioner. For our purposes today, I have divided a list of the most common homeopathic medicines used in the treatment of yeast infections to 2 categories. The first are what I call the main remedies, and I think there are 4 or 5 that I've selected. And then other remedies that are useful and the indications for those remedies. The first is Calcaria carbonica, or calcium carbonate. This is a remedy that is prepared from the middle layer of the oyster shell. And vaginitis or yeast infections with Calcaria carbonica typically are milky in color and consistency. They are fairly copious, thick, and constant. They can be profuse. There also is a fair amount of itching, smarting, and burning associated with this vaginitis. In addition to being thick, the color is oftentimes somewhat yellow, and the yeast infection can extend from one period to the next. Associated with the yeast infection, women who need Calcaria carbonica often tend to be overweight and have a fair complexion. Often they are chilly, and they have swollen and large glands, also cold hands and cold feet, and they tend to perspire a fair amount. The second remedy is Creosotum, which is a sap prepared from beechwood. Creosotum vaginitis is perhaps the most severe or worst of all the various vaginitis. It's quite acrid and burning and corrosive with tremendous itching. It also is acidic enough that it can stain the linen and even make holes in the clothes. The discharge is burning, and it burns all the way down as it runs down the thigh. And there's a burning soreness both inside and outside of the vagina. Typically the discharge is acrid and yellow, and it can have the odor of green corn. It also can be described as being very offensive. Periods can be copious and dark brown in color and associated with the vaginitis. As I mentioned, there can be violent itching of the vagina, and a feeling of swelling, and the vagina can feel hot and hard. Also, there is weakness associated with the vaginitis, particularly of the legs. People who need creosotum oftentimes are quite irritable and angry and dissatisfied with everything. They also are quite chilly, and this is a good remedy to consider for vaginitis of pregnancy. The vaginitis is typically worse walking, worse standing, and better lying.